Project Search is a program that started in Cincinnati Children's Hospital in the mid-90s, and it's all focused on students with disabilities obtaining employment, which it looks like a minimum of 16 hours of work a week and at least minimum wage.
It came about a year ago when I was actually contacted by Barry and Risa, and they had shared with me that there are individuals within our community that they felt could be placed here and learn skills that would help them become employed in the future. I thought we have a number of interns already that are here at Lakeland, whether they're nursing students or physical therapy students, and it made sense to have a group of individuals like this in an organization our size to come and learn different skills.
The overarching goals are to have students have marketable and transferable skills. So they're learning skills at the host site here at Lakeland, for example, that will, they can go to another site, obtaining gainful employment as well as sustaining that and keeping that employment is what we want to have the students or the interns accomplish. So once they leave their year here at Project Search with Lakeland, they'll still be followed along. We have a partnership with Michigan Rehabilitation Services, Disability Network, our Community Mental Health Riverwood, and Bureau of Services for Blind Persons, so as well as Lakeland. So we have a lot of partnerships going on, and just trying to find the students a job and help keep that job once their year is up with us.
Specifically in Berrien County, the students spend most of their day on the job within their internship sites, working on job skills, the soft and specific to the departments. They also have some classroom work where they're working on more of the soft skills, employability, building up a resume, being able to be successful in interviews and job search. And an important thing for them is working on those transitions from break and realizing they have to return to work and time management, working with coworkers.
We get our interns and I look at their skills and we assess their personalities, and then I have to go out and search for which departments are opening their doors to the interns or say, we have a job here that we need filled. I find the department and which intern would fit best in that department. And then I do the training process. We come up with a task list of what all needs to be done that isn't getting done on a timely basis, or perhaps some of the tasks or duties that you wouldn't necessarily want to pull somebody, let's say, making $30 an hour, and instead our interns could be doing those. That way we can free up some of the individuals here at the hospital for more patient care to focus on that aspect.
Working with Connor has just been fantastic, just to see the evolution of how he started. He works with us in the Courtyard Cafe here at the hospital, and when he first started he was a little bit shy, wasn't really quite sure of his role necessarily, but as he's gotten closer with all of the staff and he has job functions he's supposed to do every day, and he's just become part of the team, and everybody welcomes him every day, and the staff works well with him, and we certainly miss him when he's not there.
My experiences, I have done central processing and general stores. My responsibilities are down there right now are to unstock, help load the carts, check their inventory out, and we mark in the computer. We go down to general stores, print the sheets out we need, and we just fill the orders.
I'm working in environmental service.
And tell us about that experience.
It looks good.
Fun.
Yeah.
What kind of skills are you learning?
Stocking, count how many you need, count on the shelf for how much you need in the shelf.
I've learned a lot through the program myself too, because I had students that I was skeptical on whether they could do the job, and they can do it. They're able to do the same jobs as most other associates here at the hospital, and they're very successful.
So our first intern was hired within nutritional services. He is working at a part-time position right now that could lead into full-time. But again, Lakeland's realized the value and has embraced them and has hired them. And they're already looking at a couple other interns as well. One of them could be potentially hired in full-time, where he's sterilizing medical equipment and getting surgical trays set up for different procedures. So again, it's more than just the, kind of talk the talk, but, Lakeland is, kind of walking the walk and showing that these students are valuable, and we're going to show it by hiring them.